Hi guys, and welcome back to the Stretching Samurai. My name is Patrick Ravel. Today we're going to do a case for somebody that sent me their shoulder pictures. And of course, I have a few more cases to do. Please be patient. I just finished my school contract, so now I'm fully integrated into my own studio. I'm not spreading my work around. So guys, look on the Stretching Samurai. Your case is maybe up next, okay? Now, for today I'm going to work on a case, Mr. Harpreet Singh. Now, he sent me a picture. He said his left shoulder was in pain, and he has restrictions in his right shoulder, and also in his neck between the shoulder blades. Now, I've got your pictures right now. I'm going to put them right next to me right now, 1, 2, and 3, and 4. And as I go along, I'm going to tell you what I saw. You're going to see some circles around the areas I might have found interesting. Now, when we look at the left side of your picture, you can clearly see your head as a cranial extension. And if you've seen my last broadcast, cranial extension creates jaw problem, creates basically a zone of opposition, which is a diaphragm problem, and also it'll go down to your hip on the right side. Most likely, maybe your big toe is an extension. I checked that out. But if you do look at the pictures that are around me right now, you will probably see a frontal picture where clearly you can see the left side of the hip that's way higher, okay? So the left side is up, the clavicles were okay, the olecranons were okay. I like what I saw there, a little bit on the outside, but that's probably weakness from different muscles that you are not working. Although you have a good build and you seem to have good genetics. So, okay, what did I see first? Number one, let's talk about your left shoulder. I saw that your left shoulder might be a type 3 shoulder blade. Now, if you remember what a type 3 shoulder blade is, it's a downward rotation, okay? So, left is a downward rotation, and the right, let's do it so you guys can see. The right is basically lower but straight. So we have basically the shoulder that has an external and then an internal. It's just lifting up. This is you, okay? So the type 3 shoulder blade, I see basically cervical pain pattern associated with cranial rotations. So if we look at your neck, I can clearly see that you have a cranial extension, but also a slight bit of a rotation. Okay, and that causes a lot of problems, especially when we're talking about a type 3 shoulder blade. It shows that on that left shoulder you have overworked rhomboids. So you're going to have to do some soft tissue release. If you're not sure, go see the soft tissue video I did. It'll teach you how to use cross friction, basically angular patterns and straight line patterns to release a muscle. Okay? Also, compensation with rotated cranium. We have short neck compensation posteriorly. So this is what I'm talking about. And we have a long neck and interior in the front. Okay, so you're going to have to fix that. A lot of your problems of your shoulder probably start from that. Although this is very hard to diagnose from your pictures because I would have liked to have maybe up to their knees, but it's okay. I worked with what I saw. Okay, now what we're going to see also is the right shoulder. The right shoulder is a type 1, which is basically not a downward rotation or an upward. It's just straight basically and lifted internally. There's some weakness here in the lower trap, mid trap, and serratus anterior, which you're going to have to strengthen, okay? The pain between the shoulder blade, most likely, and the neck restriction that you're talking about is probably due to a superior T4 syndrome, where the subclaviculus muscle is actually jammed on the clavicle itself, and it's basically, if you're breathing, you're probably going to feel that your breathing is going to the right side here and the left side here, so you're probably going to go here, and then there's going to be no expansion on this side, okay? So all the neck problems are here. You're going to have to do soft tissue restrictions right here. You're going to have to roll it right here on the pec minor to try to maybe get it loose there. Although I would have done a superior T4 maneuver on you, that would have helped you, but sadly enough, you're in India, so we're going to do what we can to get you better, okay? So What does type 1 mean? That means that you have a limited upper thoracic rotation to the ipsilateral side. So what does that mean? That means that ipsilateral, when we look at your pictures, you can clearly see from the back picture, there's a rotation to the right. So this is called an ipsilateral rotation. Okay? So basically you're short and tight, and basically this is long and weak, and then basically you have limited rotation on that side. We need to open that side up, and this is what you're going to need to do to focus if you want to fix most likely the right side of the shoulder first, because when you have a type 1 on the right and a type 3 on the left, you always start with a type 1. Okay? So if you're like this and you can get this side open, what happens? Basically, you have a more range of motion, and probably a lot of issues is going to resolve itself. Okay? Sorry, dropped my paper. So what we got? Probably a weak subscapularis on the right side, lengthened upper trap, lengthened levator's cap, rhomboids. Definitely going to have to focus on working that type 1 shoulder. So now here comes the good part. We look at associated symptoms. We look at basically the consequences, the correlation to your problem. And now we're going to try to find out what we're going to do. Now, first thing we need to do, here's the solution. We're going to bring your body back into neutral position. That means you're going to have to stretch your neck, intercostal, QL, everything on that side. Get that expansion, open up that right side. That's going to be step 1. Step 2, we're going to need some expansion, okay? We're going to need some expansion here, and we're going to need also some expansion in the mediastinum, which is located in the type 3. I do believe type 3, how to fix a type 3 shoulder blade. But I'm going to give you the exact sequence of the exercise you need, so don't worry about that. So type 2, we're going to get some expansion on the right side. We're going to get the mediastinum on the left side to expand as well to unblock your body. That's going to help your left shoulder. Okay? Now, the moves that we're going to do, we're going to need also to increase trunk rotation and lower trap to the right. I just said it. You're like this, increase trunk rotation to the right and lower trap action. Fair enough. Okay? Now, the moves that you're going to have to watch out on my YouTube channel is the standing serratus squat push, which I've done, which is a very popular one. The sideline resisted right humeral glenoid horizontal abduction move. Okay, basically that move, I haven't put that yet on my channel. It's coming up. It's basically a move where you go to your side and then you open up with the dumbbell onto the side, getting the trap, the lower trap to activate, but with a rotation. That's all it is, okay? So we're gonna film that for you soon. Sorry. And number C, we're gonna do standing resistant right diagonal flexion, which is basically the type 1 maneuver that I've shown. If you'll go on the YouTube channel, it's going to be how to strengthen your lower trap. It's going to be shown as a type 1 or 3 move. So you're going to have to check that. And then, of course, we need to do the internal rotators. There's a lot of rotators on my channel, but we need to engage the internal rotators. We need a scapular retraction, elbows to the floor, and then engage the internal rotator without the use of your lat and also your chest. That might be very, very tight, especially if you've got a right brachial chain pattern going on here, which is very tight, okay? And once we've done that routine, which is 1, 2, 3, 4 moves, after that, once you get a lot better, a few stretches, 4 moves to strengthen, you're most likely going to do the type 3 routine. So guys, if you're interested in finding out how you are, of course, contact me by email. The email's in the description as always. And as for my friend Harpreet Singh, we are working now. I'm going to tell you the order in which you have to do to get better. And I do hope that you appreciate this little analysis of your posture, although sometimes the pictures can be a little bit hard to decrypt. But nevertheless, it's done, my friend. I'm going to send you the all chain of exercise and stretches, and you are done for today. Next time, we're going to do another case. Stay tuned, it might be your case. Thanks a lot for watching, guys. Please subscribe to my channel, and I'll see you next time. Ciao.